Hello, I'm Dr. Joe of the drjoe.com. So, question 2. Some people want to know why there is a disproportionate case fatality amongst the elderly. And so here are possible explanations for why this is happening. Well, for a start, the elderly tend to have weaker immune system. It's just a statement of fact. The older we get, our immune system becomes more compromised. So that is one possible explanation. The second explanation is that if you remember in the first video, I talked about medical conditions like diabetes, high blood pressure, kidney disease, chronic lung disease. The elderly tend to have all of those medical conditions. So we talk about underlying medical conditions, and in medical parlance, we talk about comorbidities. So when you have a combination of age and a combination of comorbidities, then of course the situation doesn't look too good. But there is a third explanation. It will appear that in the elderly, their immune system tends to become dysregulated when the virus actually attacks. And what tends to happen as a result of the dysregulation of the immune system in the elderly is that there is what we call a cytokine storm. Okay, I'm going to do a separate video to explain what cytokine storm is. But essentially, cytokines are inflammatory proteins that are released into the circulation. So it will appear that in the elderly, their immune system becomes overwhelmed with these pro-inflammatory proteins. And when this happens, this will lead to multiple organ failure. And then of course they tend to succumb. So those are the possible explanations for why the elderly appear to be having a disproportionate case fatality. So the age factor, the comorbidities factor, and the tendency to actually react in a way to produce more pro-inflammatory proteins, resulting in cytokine storm. So that explains the data that is coming from China and Italy, that majority of the cases that have actually succumbed are the over 70s, and over half of the deaths are actually people who are over 80 as well. So you see this disproportionate case fatality amongst the elderly, and in particular amongst the over 80s. So those are the possible explanations. So look out for my next video where I'm going to answer another specific question. See you shortly.